Well, hello. Dr. Dunn here. This is my Anatomy and Physiology 1 pronunciation spelling tape that goes along with the yellow pronunciation sheet that I passed out in class. The purpose of this tape is to give you the correct pronunciations of all of the words on the yellow vocabulary sheet, and to get you to pronounce the words after I do. As you know by now, you'll have spelling exams on these words, but I'm really more interested that you develop a procedure for pronouncing these words you may have never seen before, certainly not used. If you continue with your major as a health professional, whether that be nursing or respiratory therapy or physical therapy, medical lab technology, radiographic technology, med school, anything like that, you'll run into thousands of words just like the ones on this yellow sheet, and the techniques that you develop now in pronouncing them should help you really for the rest of your life if you stay a health professional. Also, the words on the yellow pronunciation sheet are the key words of the semester for this class. So if you will set up a file on your computer and define these words and understand what they mean, just don't memorize the definition, you should do quite well in anatomy. Remember that you have to pass Anatomy 1 before you can apply to many of the allied health courses here on campus, especially nursing. When you practice the spelling tests, or when you practice for the spelling exams, make sure that you have somebody call out the word for you before you write it down. If you look at the word first and then write it down, you probably won't do very well on the spelling exams. Have somebody call it out, whether that be me on this tape. I'm making this on a tape. You're listening to it on CD. Either I can call it out for you, or if you have somebody you trust, maybe a classmate, can correctly pronounce the words, have them call them out for you as you study for each chapter. Anyway, the first set of words we're going to go over go with Chapter 1. Chapter 1 is a very important chapter. It's really the fundamentals, contains the fundamentals of everything else in Anatomy 1 and really 2. Every chapter, just about every chapter, you'll use some of these words, or your teacher will, for 1 and 2, Anatomy 1 and 2. Chapter 1 is Introduction to the Human Body. So let's see what we can do with these words. The first word is ipsilateral. Ipsilateral. Contralateral. Cephalic. Gluteal. Nuchal. Popliteal, sometimes called popliteal. Sural, that's sural. Cervical. Antebrachial. Brachial. Buccal, pronounced like a belt, buckle, but not spelled like that. Inguinal, which means pertaining to the groin area. Umbilical. Antecubital. Acromial. Abdominopelvic cavity. Left hypochondriac region. Subcostal line. Note that the C in subcostal is pronounced like a K. Transtubercular line. Parasagittal. Midclavicular line. Physiological actions. Note it's physiological, not psychological. Responsiveness. Homeostasis. Differentiation. Etiology. Prognosis. Prophylaxis. Diagnosis. Caudal. Proximal. Distal. Oblique plane. Pleural cavity. Pericardial cavity. Diaphragm. Viscera. Peritoneum. Synovial membrane. Clinician. And the last word in Chapter 1, umbilicus. Chapter 4 is one of the biggest chapters we'll study in A&P 1. Chapter 4 is on tissues. You want to make sure you know these tissues: epithelial, connective, muscular, and nervous. And all the words coming up are related to one of those tissue groups. The first word then is Chapter 4 is apnea. Apnea. Pulmonary embolism. That's pulmonary embolism. Oral contraceptives. Oral contraceptives. Anticoagulants. Warfarin, which is a blood thinner. Intercellular matrix. Mucoid. Pliable. Mesenchyme. Osseous tissue, which is bone. Areolar. Hyaluronic acid. Collagenous. Reticular. Subcutaneous layer. Histology, which means the study of tissues. Epithelia. Adipocytes, which are fat cells. Squamous is next, that means flat. Cuboidal. Pseudostratified. Columnar, also called columnar. Capillaries. Mesothelium. Stratified squamous. Non-keratinized. Conjunctiva. Pharynx. It's pharynx, not pharynx. Physiological. Epiglottis. Larynx, which is the voice box. Note it's larynx, not larynx. Trachea. Bronchioles. Alveoli. Bronchitis. Emphysema. Emphysema invariably leads to bronchogenic carcinoma, which is lung cancer. Pneumonia. Streptococcus pneumoniae. That's a tricky one. That's one of the causes of pneumonia. It's bacterium. Streptococcus pneumoniae. Tuberculosis. I gave you a handout on that, or I will. Mycobacterium tuberculosis, another bacterium which causes that disease. Disinfectants. Syndrome. If you've never heard that word, syndrome means that a patient that has a particular syndrome shows the same symptoms and signs of all other patients that have that syndrome. For example, Down's syndrome. Continuing on, quadrangular, sarcolemma, striated, thrombosis, globulins, albumins, thrombocytes, diapedesis, agranular, eosinophils, neutrophils, both of those are types of white blood cells. A red blood cell, which carries oxygen, is called an erythrocyte. Erythro means red, cyte cell. Hematology, watch this one, canaliculi. It's part of compact bone tissue we'll look at under the microscope. Dendrites, intercalated discs, those are characteristics of cardiac muscle and found nowhere else. Macrophages, melanocytes, suction lipectomy, fasciae, periosteum, perichondrium, chondroitin sulfate, resilience, lacunae, hyaline, which is a type of cartilage. Articular cartilage is hyaline cartilage. Your pelvis is held together in the front at the symphysis pubis, intervertebral disc, menisci, lamellae, laryngeal spasm. Actually, that's plural. Laryngeal spasms, traumatic, keloid scar, neuroglia, parietal, lamina propria, visceral, synovial membrane. Next one's a little tricky. Parenchyma. Parenchyma. And the last word in chapter 4 is fibrosis. The next chapter is 5 on the integumentary system, which was skin and skin derivatives. This is a smaller chapter than chapter 4. The first word is superficial fasciae, stratum basal, stratum spinosum, stratum granulosum, stratum lucidum. All those previous words that started with stratum or layers of the epidermis. Iliaden, stratum corneum, papillary region, Meissner's corpuscles, edema, striae, Pacinian corpuscles, Mycobacterium leprae causes leprosy, vitiligo, tapetum lucidum, depilatory, erector pili muscle, acinar, sebum, sudoriferous, that's a sweat gland, axilla, the armpit area, areolae, ceruminous, auditory meatus. It looks like it would be pronounced meatus, but it's meatus. Decubitus ulcers, lunula, eponychium, homeostasis, poikilotherms, isotretinoin, accutane, cheilitis, systemic lupus erythematosus, contagious, psoriasis, methotrexate, sacrum, bullae, appendicular skeleton, vertebrae. Note that there's a lot of words in anatomy that end in AE. That means the word is plural, and you pronounce an AE ending like a long E. There are hundreds of words like that. So vertebrae, And the last word in Chapter 5 is debridement, which means to clean debris from a wound. It's not debridement. It's spelled differently than it's pronounced. The next chapter is 6. It's what I call Introduction to the Skeleton. There's not very many words in this chapter. The first one is hydroxyapatites, diaphysis, epiphysis, metaphysis, articular cartilage, medullary cavity, endosteum, Volkmann's canals, Haversian canals. Note that some words are proper names. They're proper names throughout the spelling list, so make sure you capitalize them if I call out that word, otherwise it's minus 3 points off, and the words are only worth 5. Concentric lamellae, interstitial lamellae, trabeculae, there's that AE ending again, ossification, clavicles, endochondral, menopause, osteomalacia, and the last word in Chapter 6, osteoporosis. The next chapter is 7, the bones of the axial skeleton. You recall there's 80 bones in the axial skeleton. Inferior nasal conchae, parietal, sphenoid, ethmoid, maxillae, zygomatic arch, frontal squama, anterolateral, occipital condyles, external occipital protuberance, sella turcica, which means Turk's saddle. That's where the pituitary gland rests in the sphenoid bone. Optic foramen. Remember that foramen is just a hole in a bone through which arteries, veins, or nerves pass. Crista galli. Meninges. Inflammation of the meninges by bacteria or viruses causes meningitis. Alveolar processes. Masseter muscle. Note that the skeletal muscles are proper names also. The masseter muscle is the one that you chew with. Tetanus sometimes freezes the masseter muscle, and it's called lockjaw tetanus. Condylar process. TMJ is temporomandibular joint. Coronoid process. Mental foramen. Mandibular foramen. Anesthetics. Lacrimal bone. Lacrimal means tears, so the lacrimal bone is near the eye. Perpendicular plate. Deviated septum. Greater cornu. Autopsy. Cervical vertebrae. Thoracic vertebrae. Lumbar vertebrae. The tailbone is the coccyx. Annulus fibrosus. Nucleus pulposus. Odontoid process. It's a feature of C2, cervical vertebrae 2. Inferior demifacet. That's inferior demifacet. Manubrium. Xiphoid process, not xiphoid. Clavicular notches. Herniated disc. Scoliosis. Coronal. Sagittal. Lambdoidal. Squamosal. Hyoid bone. And fontanelle. The next chapter is 8. That would be bones of the appendicular skeleton. There's 126 of those bones. So the words in this chapter, either the bones themselves or related terms. The First word in Chapter 8 is intertubercular sulcus. Intertubercular sulcus. Infraspinous fossa. Olecranon fossa. It's not olecranon like it's spelled, but it's olecranon. Prominence. Scaphoid. Triquetral. Trapezoid. Phalanges. Now, watch this one. It looks like it would be ischium, but it's ischium. K-E-Y. Ischium. Acetabulum. That's the hip socket. Proximal. Linea aspera. Sesamoid. The heel bone is the calcaneus. Navicular. Cuneiforms. Deltoid tuberosity. Trochlea. Acromioclavicular joint. Kyphosis. Spina bifida. Note it's spina, not spinal. There's no L. And the last word in Chapter 8, hyoid bone. Chapter 9 is next. That's the joint chapter, or articulations. The first word is subluxation, aspiration. The ACL is anterior cruciate ligament. Pronation, supination, patellofemoral syndrome, or runner's knee. There's the word syndrome again. Synarthrosis, amphiarthrosis, diarthrosis, syndesmosis, gomphosis, epiphyseal plate, extracapsular ligaments, arthroscope, bursitis, iliopsoas bursitis, monosodium urate, that's important in gout, as is supersaturated hyperuricemic body fluids, colchicine, metatarsophalangeal joint, that's one of my favorite words, so I'd watch for that one on the spelling exam, humeroscapular, tibiofemoral joint. Now watch the next one. It's a skeletal muscle. They're capitalized. Supraspinatus muscle. That's one of the most common muscles injured in rotator cuff injuries. Rheumatism, arthritis, endorphins, neuropeptides, pituitary gland, and finally rotator cuff. The next chapter is 11. This is the chapter on skeletal muscles. Remember that all skeletal muscles are proper names. The first word is tensor fasciae lati, iliotibial band, frontalis, occipitalis, orbicularis oris, pectoralis major, latissimus dorsi, latissimus dorsi, rectus abdominis, internal oblique, vastus lateralis, peroneus longus, extensor hallucis longus, zygomaticus, buccinator, sternocleidomastoid, coracobrachialis, brachioradialis, transversus abdominis, gastrocnemius, soleus, gluteus medius, gluteus maximus, teres major, anconius, Achilles tendon, semimembranosus, and semitendinosus. All the rest of the words are on the nervous system, which we'll cover pretty completely in Anatomy 1. Chapter 12 is what I call Introduction to the Nervous System. And here we go with those words. Axoaxonic, axosomatic, peripheral nervous system, Afferent. Efferent. Those are close sounding, so watch those. Parasympathetic. Viscera. Oligodendrocyte. Ependymal. Gliomas. Neurolimocytes. Myelination. Neuroglandular junction. Lipofuscin. That word has more than one pronunciation, but that one's as good as any. That is one of the accepted pronunciations. Chromatophilic substance. Nissl bodies. Axon collaterals. Synaptic vesicles. Neurophysiology. Nodes of Ranvier. Note the proper name. Nodes is capitalized, and so is Ranvier. Saltatory conduction. Axodendritic. Postsynaptic neuron. Acetylcholinesterase. I'll mention it in class, but this word will be one of the spelling words on the fourth spelling exam that goes with the fourth quiz, and it'll also be a word on the lecture final. I guess I love this word. Acetylcholinesterase. Anyway, that's 15 points you can take to the bank. And finally, Schwann cells. Chapter 13 was the spinal cord and spinal nerves. Not very many words in this chapter. Cerebrospinal fluid is the first one. Meninges again. Duramater. Epidural space. Subarachnoid space. Piamater. Denticulate ligaments. Conus medullaris. The next one's a little tricky. It looks like it's phylum, but it's phylum terminal. Phylum terminal. Cauda equina. Gray commissure. Monosynaptic reflex arc. Epineurium. Phrenic nerve. Pudendal anesthesia. Watch that one. Sciatic nerve. Tabes dorsalis. And the last word, neuritis. Plunging ahead to chapter 14, that would be the brain and cranial nerves. The first chapter 14 word is diencephalon. Hydrocephaly. Medulla oblongata. Mesencephalon. Cerebral peduncles. Substantia nigra. Hypothalamus. Medial lemniscus. Psychosomatic disorders. Satiety center. Circadian rhythms. Electroencephalograms, or EEG for short. Norepinephrine. Vestibulocochlear. Oculomotor. Trochlear. Trigeminal. Glossopharyngeal. Hypoglossal. Cerebrovascular. Poliomyelitis, and finally Alzheimer's disease. Note that Alzheimer is a proper name for Dr. Alois Alzheimer, who studied the disease quite a bit in the early 1900s. Chapter 16, spinal pathways. First word is equilibrium, exteroceptors, proprioceptors, nociceptors, which are pain receptors, erogenous areas. Yes, let's hear it for the erogenous areas. Cutaneous mechanoreceptors. Angina pectoris. Note it's not angina. Angina. Kinesthetic. Homunculus. Spinothalamic. Medial lemniscus. Stereognosis. Palästhesia. And finally, in chapter 16, narcolepsy. Well, we only have one more chapter left. It's another pretty good size one. It either took me or will take me several lectures to finish it. It's chapter 17, which is special senses. First word in Chapter 17 is olfactory. Gustatory sensations. Circumvallate papillae. Fungiform papillae. Palpebrae. Be careful of this one. It's meibomian glands. Medial canthus. Nasolacrimal duct. Glaucoma. Emmetropic, which means normal vision. Hypermetropic. Astigmatism. Presbyopia. Scotopsin. Optic chiasma. Geniculate nucleus. A part of the ear is the labyrinth. Sounds spooky. Cochlea. Scala vestibuli. Helicotrema. Otolith. Trachoma, which is one of the leading causes of blindness in the world. Pink eye is known as conjunctivitis. Sensorineural deafness. Watch this one. Meniere's disease. It looks like it would be pronounced Meniere's, but it is Meniere's. Tinnitus, which means ringing in the ears. Valsalva's maneuver. It's a handy maneuver for divers to have. Malleus and stapes. Remember that I said at the beginning of this list that these are the key words for anatomy and physiology, and you'll hear them again, some of them anyway, in Anatomy 2. I suggest you make a file where you define all of these words on the computer, and when you're learning to spell them, you also need to know the definitions. And since you have a spelling exam and a content exam at the same time, that'll serve you well if you'll do that. Remember, you have to get past anatomy or you're sunk as far as going anywhere else in the allied health fields. Well, if you're listening to this portion of the tape, it must mean that the semester is about over and finals are about to start. So, wish you luck on your finals, especially the ones in here. Remember, intermittent repetition is an excellent way to study for finals or any other exam, for that matter. And good luck. If you found it helpful. Good luck to you in anatomy, and I'll see you in class.